We are Group 15. In this video, we are going to talk about combined immunodeficiency. Combined immunodeficiency, also called CID, is a primary immunodeficiency disease caused by mutation of certain genes. This disease is resulting from an absence of T cells or significantly impaired T cell function. And this T cell defect is combined with the disruption of antibody responses, which means both cell-mediated and humoral immunity are compromised. Thus, CID is a fatal disease that causes life-threatening immune problems. As I mentioned, CID results from genetic defects that lead to absence or lack of functional T cells. And these are the examples of those defects that happens during the process of T cell development. One example is a defect in cytokine signaling. These cytokines, such as interleukin-7, bind to cytokine receptor on the T cell precursors and help them differentiate into mature T cells. When there is a mutation in cytokine receptor, or other components like transcription factor, this maturation will be defective, which ultimately reduce the number of functional T cells and cause CID. Defects in VDJ recombination could be also the cause of the dysfunction of T cells. VDJ recombination is the mechanism that creates the diversity of T cell receptors. Recombinases called Reg1 and Reg2 are crucial for this process, and when their genes are mutated, VDJ recombination doesn't work properly, which causes CID due to lack of T cell diversity. Depending on the underlying genetic defect, a patient with CID might have both T cell and B cells loss, or only T cells loss with B cell present. When both T and B cells are absent, both cell-mediated immunity and humoral immunity are compromised. And even if B cell is present, humoral immunity will be mostly compromised because the activation of B cell requires T cell dependent activation anyway. Here is the main diseases of combined immunodeficiency. According to International Union of Immunological Societies, there were 41 CIDs, including 14 SCIDs, which is severe combined immunodeficiencies. Now, let's take a look at the most and second most common CID disease. XSCID is the most common form of CID, which accounts for about half of all SCIDs. This disease is caused by the mutation of IL-2RG gene that affects IL-2 receptor common gamma chain. Since the common gamma chain is not only a component of IL-2, but also of IL-4, IL-7, IL-9, IL-15, and IL-21 receptors, IL-2RG mutations impair the signaling of these cytokines too. As a result, B cell maturation, differentiation into T cells and natural killer cells, and antibody production are impaired, resulting in a severe immunodeficiency state. This disease can be fatal if immunocompetence is not rebuilt, so hematopoietic stem cell transplantation should be performed before severe infection develops. Deficiency is the second most common form of CID that accounts for about 15% of all CIDs. This disease is caused by the mutation of ADA gene that lead to ADA deficiency. Due to the deficiency, its substrates accumulate in the cell, and their phosphorylation products, such as DATP, lead to apoptosis of T cells, B cells, and natural killer cells. In CID, the immune system is severely compromised, so for the children with CID, those pathogens which are not harmful for normal children could be fatal. Infants with CID often suffer from symptoms such as chronic diarrhea, persistent viral infections, and often have failure to thrive. Babies born with little or no immunity may live in sturdy plastic tents because they are sensitive to all kinds of infections. For this reason, severe immunodeficiency has also been called bubble boy syndrome. Without effective treatment, the probability of death in infancy is extremely high.